Я пока скажу тогда еще раз, повторюсь, основные организационные моменты. Наше мероприятие сегодня проходит на двух языках, на русском и на английском языке. Поэтому, пожалуйста, для того, чтобы...
And English. So to make sure that it is convenient to you to take part in our event, please choose the language that you prefer. You can do it in the bottom of your screen if you push the globe button and choose the language that you prefer. Please use this option. And also please mute the original. Yeah, so speakers, please also need to choose their languages. So for Nicole, it will be English, that is right. And for speakers, I really recommend to choose one language, because if you are speaking in English and in Russian, so it can happen that people will not hear you at any channel. So I see that more participants are joining. Good morning or good afternoon. So I'm happy to see that people are joining, and we are waiting for just a minute. And in a minute, we are going to start. Nastya, could you please send our technical note to the chat again, so that all the participants who are joining can get acquainted with them? Okay, so I think that we are going to start as to make sure that we use our time effectively. So dear colleagues, good morning. I'm happy to welcome you at our today's event. So we are starting our discussion, which is called COVID-19 and HIV treatment cascade. So analysis of the impact and experience of EECA countries. So we are going to present for the first time the report based on the research study on engagement of people with HIV in treatment cascade in Eastern Europe and Central Asia. So this study has a very wide coverage, 7 countries: Belarus, Kazakhstan, Uzbekistan, Moldova, Russia, and Ukraine. So today we are going to have a detailed discussion. So this event is organized by Alliance for Public Health and the team of SOS Regional Project, supported by the Global Fund to fight AIDS, tuberculosis, and malaria. And now I would like to give the floor for the welcoming speech to Tatiana Vinichenko, Portfolio Manager of the Global Fund. So please, Tatiana, the floor is yours. Thanks a lot, Ina. I would like to welcome all the participants and all the organizers. So I will speak in Russian, and I will try not to be too fast, because I tend to speak fastly. So thanks a lot for this analytical report. I think that the report is very good. It is smart, but also it has a very friendly and easy style. So I would like to thank you for this important work, like to the organizers, to the researchers, and all people who actually did this work covered by the report. So during the COVID pandemic, they continued testing, initiation of ART treatment, support of patients. This is a very important work. And from the Global Fund, we are really happy about it. So the second thing that I wanted to say about COVID, I will not talk a lot about it because all our discussion will be about COVID. But I would just like to say a couple of words. And I think that we all know that the systems were ready to adapt, and they adapted quite rapidly. And when the system is built in such a way that on the one hand, there is strong management, and on the other hand, there are different options to provide services, different opportunities to engage, different venues and different people, it works quite well. So in the report, there are good examples when, for example, centralization of services helps, or engagement of NGOs helped to retain the services in such a challenging time. But at the same time, I think that the report is interesting as it is as a cascade report, because COVID was just a way to put the light on some things which existed even before the pandemic, but the pandemic just made it clear. Like we were reading about some countries, like somewhere people are tested, but who is tested? How are they tested? But in other countries, the testing was done quite effectively, and we see that NGOs started doing more testing. That is good, but later people are not enrolled in care. So due to COVID, we also saw some interruptions due to COVID, and sometimes not due to COVID, because sometimes different funding approaches leads to a situation when certain incentives they are used in different ways. And so where incentives are used, in those circumstances, the work is effective. So it is important to have a look at countries, not just at the number of people tested, but how many people are initiated and enrolled in care. And we will not be talking only about testing, but also we will be talking about the whole cascade, about treatment as well. And the last thing I wanted to say is that the report offers very good recommendations, and many of those recommendations, they confirm things that we actually knew or maybe we assumed, but based on the research data, these recommendations show us the way to move forward. So I would like to call all colleagues from the national teams, from the regional team, like to have a look at what can be achieved in this or that country. And I would like to call also to alliance colleagues with this regional grant. We can, for example, see that we can take 2 recommendations in Kazakhstan and we can do this and that. And I would like to focus on that, because now we have many good reports, many good recommendations, but their task is to move forward what is currently done. So that is why we have regional grants to support countries in those aspects. And I'm happy to see that we have national partners with us and also technical partners, WHO, UNAIDS, colleagues. So I think that if we work all together in one direction, and such events, they actually help us to coordinate our efforts, then we will do what we want to do. So thanks a lot again for your work, and I'm really looking forward to the discussion. Thanks a lot, Tatiana. Now I would like to give the floor to Tatiana Deshka, Director of International Programs at Alliance for Public Health, for the welcoming speech. Tatiana, please, the floor is yours. Thank you, Inna. Good morning, dear colleagues. I'm happy to welcome you on behalf of Alliance and the SOS Project Sustainability of Services in Eastern Europe and Central Asia, supported by the Global Fund. This is a very important event for us. So we started the project almost 3 years ago. Well, the key problem that we wanted to address in the EECA region. This is access to HIV cascade for people living with the HIV in our region. Unfortunately, the coverage is only 44%, and there are thousands of people who do not have access to the treatment they need. And in the middle of the project, we had COVID crisis, which affected greatly health systems and, of course, HIV/AIDS programs as well. Unfortunately, this influence was very difficult and challenging. It complicated the work of the programs, and we saw that in some countries, the scope of HIV testing went down. In Moldova, for example, it went down by 1/3 as compared with the pre-COVID situation. In Ukraine, the decrease was over 20%, and the pace of patient enrollment in treatment also went down. In those two countries, for example, we saw that the number of new patients starting ART went down by 25%. For example, if we look at Moldova, or 10% was decrease, and in Ukraine and other countries. So we wanted to improve the cascade indicators, but we couldn't do it because of the difficult situation. And the countries, they dealt with the situation in different ways. Somewhere, as Tatiana Vinchenko said, a decentralization of services helped. Sometimes civil society engagement helped. So countries tried to address this crisis in different ways, and we thought that it is important to look at which actions, which interventions helped to retain the levels of cascade or to improve the indicators, and in which cases systematic circumstances and obstacles didn't allow to improve the cascade. So we did a research by specialists from the region, and we are really thankful to the study research team who were able in such challenging time collect important data to make an analysis and have lessons learned on the cascade in the times of pandemic, and how we can strengthen the cascade and strengthen health systems in the region as a whole. Now it is a very important time because we see that the pandemic is continuing, and we are now looking for solutions and ways to resolve certain issues related to HIV in the region. Many countries now are preparing applications to C19 RAM Global Fund mechanism, and now it is the time where we can take lessons learned and take them into account when submitting proposals for future funding. So we have great expectations about today's discussion about further things which can be done to implement the recommendations in practice. So thanks a lot. So I'm looking forward for our fruitful discussion. Thanks a lot, Tatiana, for such a wide and broad resume. And now we start our main part of today's event. And before I give the floor to our first researcher, Konstantin, while I'm introducing you, please share your screen with your presentation. And I would like to remind all the participants that we have a recording of our event today, and please choose the language that you would like to use today in the bottom of your screen. So the first speaker who will present the general overview in the region as well as recommendations is Konstantin Dubchev, Principal Researcher and Director of the Ukrainian Institute of Public Health Policy. So he does research in the area of psychoactive substances use, HIV/AIDS, including epidemiology, efficiency of HIV prevention and treatment programs. So Konstantin, the floor is yours. Thank you, Inna. Good morning, colleagues. I am happy to start the presentations today, and the report and today's agenda is built in such a way that we start with the more general things and then we go into more detail. So we will start talking about the region as a whole, and then we will talk about certain countries. So I Well, and now I'd like to say thank you, first of all, to the Global Fund, to Alliance for Public Health for our close cooperation and logistic support, and a really important help to our, and also I would like to thank our study team. We had 5 people in our team, representatives of the Ukrainian Institute of Public Health Policy, and I will honestly say that we did a big job in very short term. So I'm really grateful to all my colleagues for such intensive engagement, and also I would like to thank representatives of all the countries. Without their participation, this study and this report would not be possible. So now my first presentation, it will be about the results, and I want to say a couple of words about the methodology of our research study. So about the methodology, our study was carried out using different methods. The first task was to collect quantitative data for the indicators of HIV treatment cascade, including testing indicators, number of tests, number of positive results. So we collected this data for each month to see the dynamic in time. And if possible, we try to collect data for each key population and also see the dynamic. And we put this data into special forms, special tables, which allowed us to show certain trends, looking at the changes in those indicators, and then analyze this change. After the testing, we also looked at enrollment in care, registration of new HIV cases, initiation of ART, like the number of new patients in ART and the general number of patients. So in such a way, we looked at possible dropouts. Also, we looked at AIDS mortality. And at the same time, to look at those indicators in the context of epidemiology and COVID-19. We also looked at the dynamics of COVID cases and deaths. After we built those trends and we saw evident clear changes in the dynamics, so to interpret or clarify them within our next objective, we had in-depth qualitative interviews with experts, with service providers from all the countries. And in addition to explaining the trends, we also asked the respondents like what was done in the countries to adapt to the situation, and like what steps were taken. And within the third objective, we interpreted the data collected and we integrated them and compared them with the other reports and other data to analyze in a comprehensive way the dynamics in the indicators. And I would like to say that our task was not narrow just to assess the impact of COVID-19, but we wanted to look at the changes in HIV cascade, not only due to the COVID crisis. So our conclusions are broader than only relating to the COVID situation. And as Tatiana Vinichenko said, that COVID-19 is important, of course, but also our analysis allowed us to see some systematic problems that we need to address anyway. So now we will talk about some more general results for the region.
Well, it's natural that the pandemic has affected service provision all over the region. And you know very well that, service providers, they come from state facilities and NGOs. So both sectors tried to adapt in its own way. So there was no major failure. However, testing in NGOs went down at the very first stage after first lockdowns were imposed. And in general, the epidemiological situation was similar all over the region. So as soon as first cases started, then lockdowns also were imposed. Then at the end of May, partially they were relieved, but then in the second half of the year, there was the next wave. And so in the very first wave, in most countries, there were reductions in the number of tests conducted. However, NGOs managed to adapt quite fast. So COVID actually kick-started many innovations and the introduction of many practices. And we try to analyze them, and we will see them a bit further. So the number of tests conducted in healthcare facilities went down as well. However, the reduction was more significant than in NGOs. And in many countries, it did not get back to pre-COVID level. There are different reasons for that. Firstly, as one of them, for example, that is traveling. People just don't travel to hospitals as often due to transportation restrictions, and also because they are not willing as much as previously. And also some hospitals were repurposed as COVID hospitals, and also they stopped providing other services. And that is why the level of testing did not restore on the same terms. And another factor influenced by the reduction in the number of tests is, of course, case registration. There were many other barriers, as I said, due to restrictions in transportation and due to lower attendance. And in countries such as Moldova, where testing in NGOs went up, they still didn't see the increase in the number of new case registration. So this situation exposed a problem with and the next was the reduction in all over the cascade. But of course, it happened differently in different countries. And it has exposed different issues in different countries. There were issues. So even regardless of the test and start, the barriers remained in many countries. There's a bottleneck with lab testing because, well, to begin HIV testing, you need to have a lab test, and many laboratories were overloaded. In Ukraine, there were also issues with the procurement of drugs caused by some systemic peculiarities and also COVID overload. And especially in the first months of the year, that was very evident. But overall, we can say that significant efforts have been applied by both the public healthcare facilities and NGOs, and there were cases of good cooperation which prevented interruption of ART provision. So overall, the number of patients on ART continued increasing, even though the acceleration was not as high, but it was still coming up. And we did not see the increase in mortality. So and also the pandemics has been an incentive to introduce new practices, such as dispensation of take-home medication or mailing the drugs or decentralization. For example, in some cases, the drugs were dispensed right after the lab examination. So these practices should be, of course, expanded. And the first group of recommendations is about emergency response. In the context of COVID situation, well, the pandemic is not over yet. And in these situations, it would make sense to create some coordination centers at both national and regional level, which would take into account the experience which has been accumulated before. And it has to be also reflected in action plans, in emergency action plans. The bottlenecks, they have to be identified beforehand, and the solutions have to be identified as well. So in the preparation of this report, we have noted many best practices, many innovative practices, and it would be great to somehow make a systemic overlook, to have a compendium, a comprehensive collection of the practices, and to try to scale this experience up to make the practices available for other countries. And there are also some more specific recommendations, even outside of the COVID context. We still see the need for decentralization. It would help increase the resilience, and it is useful for the patients. And just as in many countries, the further reduction of the threshold is required. And the comprehensive introduction of the test and start, that would be important, and the special interventions for key populations. Also, in the countries where there are issues with the logistics and the procurement of drugs, one needs to establish the mechanisms regardless of the COVID, especially when there's such a crisis. Well, this is highly relevant. Also, we would continue to develop remote access to services, such as testing, for example, the delivery of kits or the delivery of drugs for those who are already on treatment. Also, we see potential benefit in the development of the methodology of ART interruptions risk screening, because there are patients with a high interruption risk, and they can be found early, and they can be engaged in the interventions which will help prevent the interruptions. And the last conclusion, well, it was rather a conclusion for us as the researchers, that we can conduct another in-depth analysis of the pandemic's impact, not only looking into disaggregated figures, but also about the impact on patients' health. And we can look in more details about the impact on viral load and viral suppression. So there are still many things to be studied, which could be really useful. But overall, this is it from me. Thank you. Thank you, Konstantin. And while I introduce the next speaker, I would like to ask Alexander to share his slides. And Alexander Zizulin will present about the situation in Kazakhstan. He's a senior fellow in Ukrainian Institute of Public Health Policy, and he's working on deepening the knowledge about HIV, drug abuse, and tuberculosis, and other issues which face different populations when they're receiving health services. Hello, can you hear me well? Yes, indeed, we can hear you well, and we see your slides. That's perfect. So I will be speaking about the Republic of Kazakhstan. And I will mention briefly the situation in Russian Federation, because there are certain similarities between the two countries, and I will be speaking about that as well. So the study was quite difficult at some stages because we didn't have enough time and all the stakeholders were very busy. And once again, I would really like to express my gratitude. Thank you very much. And especially, I would like to express my gratitude to Ms. Maria Samko, our coordinator. Her work was crucial. We wouldn't be able to make it in time without her. So, Kazakhstan. The Republic of Kazakhstan had 2 waves of strict lockdown. In early spring, March to May 2020, and in the summertime, July to August. And the indicators responded, of course, but they responded in a different way. If we take a look at NGO-based testing, if we compare 2019 and 2020, we saw that the indicator went up almost 14%. In the first half of the year, there was 30% increase, and in the second half, the reduction was only 1%. Why? When we were conducting the qualitative study, we saw that in 2019, the Kazakhstan was undergoing the decentralization process, and NGO testing was being introduced. So this program was kickstarted very well, and that is why it helped to compensate the issues during the lockdown and even achieve the increase. The NGOs had been conducting rapid tests, and they did quite well, but at the moment they have issues with the procurement of the tests. And also in Kazakhstan, they cannot use blood samples in NGOs. They cannot conduct blood tests. There were only 1 or 2 pilot projects where this was attempted, but it didn't affect general figures. So the situation in Kazakhstan in terms of the number of testing in healthcare facilities, it was on plateau. The difference was about 1%. There was no growth. Our experts said that there were restrictions imposed, and the demand for testing and access went down. In the beginning of the critical period, the indicator went down a bit, but at the end of the year, through very successful policies of the Kazakh National Center of Venerology and Infectious Diseases, they managed to get the indicator back to 2019's level. In terms of registration, there was a reduction, almost 6% reduction in the number of patients who initiated ART in a month in 2020. And in certain months, the drop was even 45%. And the explanation was linked to the changes in data collection and changes in legislation, but mostly the factor was lack of access to AIDS centers. AIDS centers have limited the attendance of people for all the service provision, all the HIV cascade services, and also in the country, only about 7 NGOs were continuing the operations, working with PLHIV. All this has added to the situation of reducing the number of people who initiated RT. Another finding, and quite an important finding in Kazakhstan, was the information that currently there is also another epidemics of synthetic drugs in the country. When the borders were closed and drug users, well, they had a change in their usual menu of drugs, they found a channel of other drugs which entered the country, and they replaced the usual drugs. So on the consequences of this shift in drug use, we saw that many key populations became hard to access because even the demographics in key populations changed, and that's why it was difficult to reach them, to prescribe ART and to keep them on ART. So the conclusions: decentralization was very successful in Kazakhstan, and NGO-based testing is a very good model. It has shown its resilience. However, difficulties with procurement and the rapid test logistics, they are still a barrier. The pandemics overall has influenced the coverage with testing services, and both the access and the demand for this service went down. However, we saw in our indicators that that through the decisions by the Kazakh Strategic Center and the strategic leadership of the healthcare system, they managed to compensate for the drop. In the first wave of the lockdown, healthcare facilities, many healthcare facilities were closed or working with restricted access, and especially people living in remote areas suffered from that. Once again, I would like to say that the drug use scene has changed in the country, and it requires an additional research. What can we recommend? We can say that the cooperation of the NGOs and the healthcare facilities and public facilities should be maintained. We need to scale it up, and we need to continue with this forced decentralization of lab services. When lab testing was moved from the national center to Rayon AIDS centers, I mean the testing for HIV diagnosis, and it really helped improve the indicators. And the last but not the least is that we have to study the situation at the drug use scenes and how it affects the cascade. Thank you, and this is it from my side. Thank you so much, Alexander. Now we move to the third presentation. So Tatiana, feel free to share your slides on the screen. And now I would like to give the floor to Tatiana Kyrgyzstan, Senior Fellow in the Ukrainian Institute of Public Health. Tatiana's sphere of professional interest has access of key populations to HIV and TB treatment programs and harm reduction programs. Tatiana, the floor is yours. Over to you. Also, while we are setting up the presentation, I would like to mention two things. Feel free to use the chat box for all the questions. We will be responding actively to try to make it as interactive as possible, and we have overstepped the schedule a bit, so we will try to catch up, really.
Tatiana, you have your mic off. Please unmute yourself. Sorry, I wanted to say quickly, thank you for the opportunity to give my presentation, and I would like to join the previous expressions of gratitude to all the experts and participants of our study. So the first presentation is about the dynamics of the HIV services in Kyrgyzstan. And as you can see on the first graph, the average quarterly number of NGO-based HIV testing in Kyrgyz Republic decreased just by about 2.4%. So the most significant decrease took place in the second quarter of 2020 during the lockdown period by over 55%, but in the third and fourth quarters, the number of tests increased thanks to the fact that in 2019-2020, the modality of testing changed, and NGOs, they did not only test the traditional key populations, but they started testing partners of people living with HIV, and they also started mass testing, testing of internal migrants in cooperation with medical workers, and medical workers also tested people with the clinical indications with symptoms of HIV. And the number of positive tests decreased compared to 2019, but first of all, because fewer people were seeking testing services, and colleagues from Kyrgyzstan said that first of all, NGOs tested people who were not socially adapted, so many of them lost employment, they had more problems, and they were not seeking medical services, they were thinking about their survival first of all. And in 2019-2020, the number of positive tests among the main key affected populations was the smaller part of the total number of positive results. And again, if we see a decrease in the number of dedicated HIV cases among key affected populations, especially people who inject drugs, there were growing numbers among migrants, partners of people living with HIV, etc. So while there was a certain increase in the new HIV cases among MSM and transgender people, the detection among people who inject drugs was decreasing. And as my colleague said, so the drug scene is changing, and the salts, the synthetic drugs, which are now used instead of heroin. So people who use the salts, they are not even covered by medical services, so their like drug using career so-called leads in 1 or 2 years them either to deaths or to hospitalization in psychiatric institutions. So countries were not really ready with the services to offer to this key population. So it is also one of the tasks to be resolved in the nearest time, so we need to address it. And if we talk about testing in health facilities, the average monthly number of HIV tests performed in health facilities in 2020 decreased by 11% over 11% as compared to 2019, especially in April, because in April there was a lockdown, and also in September there was a large decrease, and there was a high number of tests run in September of the previous year, because there was a mass campaign to test medical workers, and all the health system was first of all aimed their efforts to fight COVID, and in October there was or actually in June, there was certain increase in testing, and it was related to testing of migrants who returned home, and they were tested for COVID and also for HIV. So there was certain growth of HIV testing. If we speak about the number of detected HIV cases, especially in April, July, and September, it went down, it decreased by about 14%. So people did not receive testing services, and they were not seeking medical services often. But HIV testing and detection about key affected populations was the smaller part of the total number of positive testing. So key populations are mostly tested in NGOs. If they are tested in health facilities, they are usually not registered as belonging to key populations. And according to the experts, during periods of high number of testing, more new HIV infections were detected in 2019. And in pursuit of fulfillment of testing and detecting new HIV cases indicators, some organizations tested key populations, as one of the colleagues says, not very differentially. So not only key populations were covered, but also other populations with not so high rates of HIV. If we speak about the number of patients enrolled in care or registered with HIV infection, the decrease was an average only by 4.3%, and the dynamics of the new cases registration and enrollment in care mirrors the dynamics of COVID-19. And by the end of the year, we see that the dynamic in October was almost at the same time as before the COVID crisis, and the cumulative number of people living with the HIV registered was increasing as well in 2020 and in 2019. However, there were certain obstacles which did not allow to increase this indicator even more. The average monthly number of patients taken on ART in 2020 decreased by 14.5% compared to 2019, and the experts say that this decrease mirrors the dynamics of the pandemic, and they relate the enrollment in care to the impact of the pandemic, because if people were seeking enrollment in care, especially people with HIV infection, they tried to stay home. They tried not to go to healthcare facilities because of the threats to get infected with the COVID. And the initiation of ART is such a thing which can be actually delayed. But at the same time, the number of people on ART was growing due to the third part of cascade. So because of efforts aimed at adherence, so using more the gravir-based regimes, and these efforts in the country are planned, and they are consecutive in cooperation with NGOs and health facilities, and these efforts give their result. But if we talk about the conclusions, the pandemic certainly had a negative impact on the level of NGO-based HIV testing in the first part of the year. However, due to enrollment of other key populations such as migrants, people with clinical indications, and partners of people living with HIV, the NGO-based HIV testing even exceeded the same indicators in 2019. The detection of new HIV cases decreased partly due to testing of populations with lower rates of HIV, and partly with the change in drugs seen. But in general, the decrease was not so large as could be expected due to the pandemic. And in general, the pandemic had moderate impact on reducing the number of healthcare facilities-based testing, and the detection rates also went down, especially in key affected populations. Average monthly indicators of registration in 2020 compared to 2019 decreased insignificantly, and the positive dynamics was retained. And experts say that fewer people being enrolled in care were due to the pandemic and insufficient level and coverage of consultations due to the lockdown restrictions, due to limited opportunities of face-to-face meetings between medical workers and clients. And the focus of healthcare systems was on COVID-19, of course. A positive fact was high level of patient retention on ART, and the development of the ART adherence plan and standard operation procedures on the drug supply logistics and increased government funding played a role in this. So first of all, ART drug supply was funded as a priority, and there was no deficit. And talking about the recommendations, of course, there is a need to optimize NGO services models to increase the coverage of testing and support for KPs, and a particular attention has to be paid to people who use new psychoactive substances, and also there should be sustainable state funding, including NGO contracting through the social contracting mechanisms. So it was planned to happen, but due to lockdown, it was not possible to the full extent. And also there is a need to analyze the impact of migration processes on retention in treatment and consider the ways to provide ART drugs to patients working abroad. So in some other countries, this work was ensured, and there were some NGOs working in the Russian Federation. So people who living with HIV and who were labor migrants from Kyrgyzstan and Tajikistan, they were able to have access to ART free of charge for a certain a period of time, and then they were able to get those ART drugs from their motherland. Other recommendations are to analyze the possibility of introduction of selected components of the anti-crisis response implemented, which have been proven their effectiveness in the context of pandemics, such as community-based ART distribution, take-home drugs for a longer period, delivery of drugs to the patient's place of residence, and delivery of drugs for migrants to other countries, expanding self-testing and take home doses of liquid methadone to OST patients for a 5-day period, distribution of preventing the kits, reallocation of funds within the framework of existing programs, reserve stock of ART drugs in warehouses, and additional training for HIV service providers. So thank you for your attention. So it was presentation based on the results of work in Kyrgyz Republic, and now I will start presentation on Tajikistan. So speaking about data for Tajikistan, I need to say that data on NGO-based HIV testing was not provided, but the monthly number of HIV tests in health facilities decreased in average by 18.6%. So it was a rather big decrease, and experts say that it happened due to strict quarantine restrictions, which led to smaller coverage of testing, both in healthcare facilities and they think also based in NGOs, because many of them, people worked from home, and they decided not to do mass testing campaigns in different populations, which are typically done in the country. If we talk about the methods of the study, a restricting factor for NGOs was that now NGOs mainly test key populations for HIV using saliva tests, which are purchased using the Global Fund funds and other international organizations. Previously, 3 NGOs with the capillary blood collection sites equipped in accordance with the Ministry of Health regulations, they conducted HIV testing with rapid blood tests, and widespread application of oral HIV tests allowed to increase the coverage of KPs with the testing. So the confirmation of diagnoses in the country is done either like with one rapid test and 2 or 3 ELISA tests, and if around 400 healthcare facilities, they allow people to access rapid blood tests, but only about 40 institutions can do the confirmation tests to establish diagnosis. If we talk about the number of detected HIV cases in at the health facilities, the decrease here was smaller, in average by 11%. So in January 2020, there were almost twice more new cases of HIV infection detected compared with 2019. So it was before the pandemic, actually, and also it was due to some peculiarities in provision of the annual statistics provided to the Ministry of Health, and people detected in after mid-December, they are usually recorded and reported in statistics in January next year. If we speak about the average monthly number of patients who initiated ART, here we see a large decrease in the country by 33% compared to 2019. And the reason, according to experts, is related to the COVID-19 pandemic, because doctors provided limited tests and NGOs worked remotely. There were several lockdowns, so quarantine restrictions. So NGOs, people worked from home, and they did not provide the services they usually provide according to the protocol. And if we speak about the lockdowns, the first lockdown was really strict. So after it, people started interacting and visiting their relatives. So the second lockdown was also strict, and both lockdowns they influence and affected people seeking care in medical institutions. Also, in the country there is active work to find people living with HIV lost to follow up, where NGOs together with the health workers, they are trying to find people who dropped out. And one of the experts say that if they detect 1,500 new cases and they find about 200 people lost to follow up, there will be around 1,700 cases altogether. But of course, these efforts also were aggravated with the COVID crisis. But generally in the countries in 2020, there was a positive growing dynamics of the cumulative number of patients on ART. It remained, and this was first of all due to the great efforts of the medical staff who, in cooperation with NGOs, maintained phone contact with the patients during the lockdown period to ensure their retention in ART, and also with the relatives of labor migrants who were in the Russian Federation, and they ensured distribution of the ART medications. They contacted friendly NGOs in Russia. So by September, people had free access to ARVs, and after that, they were able to purchase the ARVs in pharmacies. And after it was possible to send ARVs to the Russian Federation from their home country. So this process started. So this model of successful cooperation between health facilities and NGOs, it can be seen as a successful practice that can be recommended for scaling up both in emergency settings and in routine HIV service delivery practice. And furthermore, during the lockdown period, patients on ART were given drugs for a longer period of time, and also they could receive drugs at home. And one of the factors here is also labor migration, both external and internal. And in terms of conclusions, in the absence of statistical data on NGO-based testing, qualitative data showed that the level of HIV testing in NGOs was significantly lower than in 2019 due to the regulatory requirements mentioned, but cooperation between NGOs and healthcare facilities and implementation of new testing models, also with saliva tests, allowed to partly compensate for the decrease in the number of tests in healthcare facilities and NGOs. So the number of patients who initiated the ART in 2020, it also decreased due to introduction of restrictive measures, but in Tajikistan, even after the end of the lockdown, the rates of registration and ART initiation did not recover to the pre-COVID period. And the progress in the context of COVID-19 is primarily associated with the retention of patients on ART. And there is a good interaction of state agencies with NGOs. And it is important because at the moment of the report preparation, we did not know the results of the national program implementation for 2017-2020. This analysis will be the basis for development of anti-crisis models for the provision of HIV services in the future. And one of the other negative moments was problems with the human resources because of suboptimal work conditions and growing workload for infectious disease doctors and doctors who were at the forefront of the COVID fight. Of course, it had a very bad impact on the functioning of HIV services, especially in the conditions of biological hazards. So as recommendations, it is necessary to ensure sustainable functioning of the existing successful model of joint operation of the services of NGOs and healthcare facilities-based HIV testing within the transition from donor to state funding. Because we have this transition in the country and the treatment is covered up to 70% by the government, but prevention services are currently covered by the Global Fund, and the programs, they do not stipulate any changes in testing models, though experts say that it is necessary to focus attention not only on traditional key populations, but also cover people who use new psychoactive substances, partners of people who live with HIV, and labor, migrants, and other categories which are underserved now and which have a growing HIV epidemic. It is also recommended to continue and strengthen international cooperation at all components of Cascade and develop scenarios of rapid response to emergencies with international donors, because we see that the services were not recovered even after the lockdown.
And we need to study the reasons why the registration level is still lagging behind the pre-COVID times, and we need to develop a comprehensive set of interventions with international donors so that we'll have really an comprehensive interagency approach to make sure these services have continuity. We need to also to plan the transitioning of funding from the Global Fund to state funding in advance, and to have a provisional plan to ensure continuity for the period of this transitioning. And we have to consider the changes in the HIV prevalence dynamic among the key populations, and also look into the staffing policies when we talk about service providers. Thank you, Tatiana. Now we get to the next section. This is an open discussion about the results. And now I would like to give the floor to Aybar Sultangaziev, the Executive Director of the Partners Network Association. So, dear colleagues, please, can you hear me? Yes, we can hear you. So we can also discuss about how the trends are there in 2021, because the report is for 2020. So Aybar, if you could please select the Russian language, then you would be able to hear us. If you press the globe icon, you can select. Oh, apologies for asking to give me the microphone right now, because I have another event I have to attend, so I will be leaving soon. So thank you so much for this presentation. I read it carefully yesterday, and yeah, I fully support it. It is well noted. And I wanted to say a few words about the situation with COVID and HIV and TB. Well, you know that in February and March last year were the months when the world was in the state of shock. So closer to the end of March last year, we have initiated a few things which really have shown the effectiveness. We have revised the dispensation period. I mean, the methadone, TB, and HIV drugs, they were issued for longer periods. Previously, we were giving that only, for example, for 5 days for methadone. And when the lockdown was announced, we issued the syringes for a month. And by the first day of lockdown, we managed to respond fastly, and we managed to provide whatever people needed. And this really helped to ease the impact of the lockdown. So already in early April, or in the last 2 days of March, we have approved a plan to adapt the HIV and TB programs to COVID. And this really helped us to get out from the state of being lost and disappointed, and to move to proper operation in the new environment. And well, HIV services, they already were well prepared to work in the emergencies, because the wide network of the NGOs and the decentralized services at the primary healthcare level, all this already was there, and human resource was available to make sure the services are properly scaled up. So the plan has enabled us in the early stages of in May, we managed to redistribute $40,000 to COVID from the savings, and then in July we got funding from the Global Fund, and we really worked quite fast. So this planning, this fast planning and fast adoption of measures has really helped us to compensate, to cushion for COVID. But then we faced another situation. Now we have to leave after the acute period was over. For example, after autumn last year or this spring, we had to understand that it's going to be a long-term thing. So in the beginning of this year, we have developed another plan on how to scale up testing. For example, in the figures you've seen already, we started organizing workshops last August for people from the NGOs and healthcare facilities, because they all were under stress and they didn't know how they should proceed. And that's why already in September we started catching up where we were lagging behind. On ARTs, we would like to say thanks to our Russian partners, because in April and May, when strict lockdown was imposed, then we used some of the resources available for Russian Federation and a little bit from Turkey to make sure there would be no stock out. And already after a few months, we managed to ensure that we have proper stocks and to set up the system of mail deliveries of drugs. And also we have launched mobile teams, because we saw that we have to bring services closer to people, both testing and counseling. So of course, services like counseling, they suffered because the first priority was on most vital services. We had a first priority of keeping people alive. And of course, the reduction of testing also has influenced the detection. For example, people with HIV, with pneumocystic pneumonia in COVID hospitals, they are detected now on later stages. We had 2 or 3 cases that people have died after detection. So of course, we are upset that some people are now detected quite late, and COVID prevented us from saving their lives. Also, people with later stages of TB are now detected in COVID hospitals, which also is an issue. So now we try to introduce wider testing, and in COVID hospitals, people also are tested for HIV with rapid tests. This is another resource, because it helps us compensate for the triage or the lack of triage. And we introduced that HIV testing after we found the pneumocystic pneumonia in a COVID hospital. And also, some things we managed to overcome, but some issues remained. And of course, it all was stressful for the whole society and for public health sector in particular. And the sector really requires extra efforts to rehabilitate the mindset of people and the attitude of service consumers, because now death from HIV or death from TB is kind of a longer perspective. It's not a big priority, well, or at least it's a lesser priority than death from hunger or starvation or poverty. Also, we had political turmoil, we had changes in the government, and we are also now thinking on how we should proceed to keep the services. Because now they want to cancel all legislation that has been adopted previously, and they want to adopt the laws from scratch. And that includes the law on AIDS and HIV service. So new challenges come up, and of course we have to really remember that HIV should be a top priority. Key populations are a top priority, and we've sent an additional application to the Global Fund recently, because it's very important to support our populations now, so that they would feel the support, and so that health would remain a priority. So this is what I wanted to mention. Thank you, Aybar. Next, I give the floor to Nurali Majol, the president of Central Asian Association of PLHIV. Nurali, the floor is yours. Hello, dear colleagues. Thank you for the report, for the presentation. On Kazakhstan, I can say that, yes, everything is presented correctly. If some things were omitted, they were added in the comments at this event. So, of course, when the situation started unfolding, yeah, the first priority was maintaining the continuity of ART, not keeping up with the testing numbers. And we understood that many people in lockdown times lose their income. So we tried, we helped many people to apply for the state subsidies, the aid of about $100 per person. And also we were buying this certificate, like food stamps, and distributing them. The food stamps in cooperation with the supermarket chain. And also on ART, with Mr. Basirkin, we immediately issued an order to dispense the medication for a 6-month worth, and the first protocol came out. We even had a small influx of people on ART because, well, people thought that ART can help against COVID in those early days when treatment guidelines varied a lot. So now things are more stable. We have NGO-based testing, and the only gap we have now is with self-testing, but we are continuing to work on this. Well, this is it. Thank you, Nurali. Thank you so much. Next, I would like to give the floor to Dr. Nicole Sigui. She is the head of HIV and viral hepatitis in WHO. She is online with us. So, Nicole, over to you.
Good afternoon, everyone. It's really a pleasure for WHO to be in this very, very important dissemination meeting of the result and the strong recommendation from the survey. So first, congratulations for conducting this survey. I think this comes really timely with the possibility for countries to apply for the Global Fund C19RM funding request for COVID, but also for mitigation of COVID impact. What I've seen from the presentation is that we have quite good consistency in the result. So first, significant decrease in testing, and the return back to normal is not there yet. So this is also consistent with many other surveys findings that have been done in the region. And just to let you know that WHO Regional Office for Europe, we will conduct a kind of a review of all the studies, including this one, because this one is the most important for the EECA of the region, to try to consolidate the finding. But overall, I think we're finding the same trends, and to recommendation, consolidated recommendation on what's next. What next in terms of programming and in terms of monitoring. So few comments. The technical comments on the methodology, we will provide them directly to the writers, because it's not maybe too detailed here for this discussion. Some comments on some refined analysis for future survey or for this survey, maybe to understand better, if possible, the new diagnosed decreased and the new on ARV. So the decrease in newly initiated on ART is mainly due to the decrease in new diagnosed, but what's the proportion of the issues linked to the ARV availabilities in some countries and the ARV accessibilities for the population, including key population who may have had less access. So that's one of the, I heard that there was some kind of analysis around that, but it could be done more in depth in some countries. Also, how much this COVID has impacted particularly the key population cascade, and we are going to try to have more refined analysis of key population cascade, which is quite difficult, but this is very important to see how much it has impacted key population specifically. Best practices, because I heard in the first presentation a call for best practices and innovation. Has made a call for best practices that will be disseminated through a compendium of good practices. The call is over, but we can see if we could extend that call if there is a need. Because it's very important to consolidate the findings on those good innovations. And I fully agree, and we at WHO, we are very, very vocal about this, the decentralization of testing. We really need to use this opportunity of this COVID situation to advocate for further decentralization of testing, screening by lay providers, NGOs, and also simplification of the testing algorithm by removing of the Western blot that delays the test results. So this is something that we should all advocate for. This is very important because this is the way to make the changes and get more people diagnosed in our region, and particularly in Eastern Europe, Central Asia. Now the use of the results. I was really happy to see a very strong recommendation, very clear recommendation in the report. So first, the use for the next proposal, the C19RM opportunity to include mitigation efforts and also to include patient safety measures to restore the confidence in going to services. Advocacy. We need to use the result for advocacy for mitigation, but also advocacy for keeping the momentum on our program. We have innovative ways of implementing our programs, and we need to advocate for more involvement of civil society, because we have proven during this pandemic that civil society was very important in the response. So advocacy, we need to use that. I heard a lot about innovation for migrant access to ART. Again, we need to use that for advocacy for the next step in our programs, social contracting of NGOs, and advocacy for programming key population programs. Because we increased vulnerabilities during the pandemic as well. So it's not only that it's necessary because we have key population driven epidemic, but we also have increased vulnerabilities of our key population because of the pandemic. So there is an opportunity to use the finding of this research, these surveys, to really advocate to keep the momentum for the elimination and use the innovation, but you have the rationale and you have the scientific evidence from this survey to demonstrate that we need to make those changes. So we should not miss the power of this type of survey for advocacy purposes. Now, next step of analysis, I don't have the answer right now, but as you all said, the pandemic is not over. So it's becoming a chronic problem. We will have a better situation, but it will take some time. And so how do we monitor the impact of COVID next year or in 6 months from now? Just a few ideas. We would need to think about light surveys. What would be the methodology? Similar light. Can we include a few questions on some next IBBS, for example, if we want to see the COVID impact on key population limited question to understand better the KP cascade, the accessibility of services for key population during the time period where COVID, the accessibility of ART services, the dropout, what was linked to the fear of getting COVID, etc., and maybe something also about the access to COVID vaccine. So just to put some ideas for thinking about monitoring on the long term. But the top priority is use the research finding for advocacy to maintain our program and focus on the most vulnerable population. Thank you very much. Excellent work.
Thanks a lot, Nicole, for such a feedback. And on behalf of my colleagues, I can say that we will be happy to continue cooperation with you, like on reports and on discussing the feedback. And before I give the floor to our next speaker, I would like to say just one thing, that we are a little bit out of time. So I would ask our next speakers to try to speak briefly. We will have a second section at the end of our event for discussion. So please, I would like to give the floor to Olga Belyaeva, Program Coordinator of the Eurasian Network of People Who Use Drugs and Food. So Olga, please, the floor is yours. Good afternoon, dear colleagues. Thank you for invitation. So now here next to me, I see different like instruments and different like paraphernalia for people who use drugs, and we always take them for different training events. So if you we're talking about access to services, yes, there is such access, but if we speak about OST, substitution treatment, which is in WHO recommendations together with ART, but so far people are not able to have access to OST in hospitals and at home. And imagine people when they live in a house and their like apartment blocks are just closed. People cannot leave their homes, and the person is not able to leave home to get the therapy. And maybe someone didn't understand the philosophy of harm reduction, stating that the issues of mental health and attitude to lifestyle of people who use drugs. And when we tell you that please help us with prevention programs to make sure that people who use non-injecting substances, make sure that they continue using non-injecting substances, and for those who inject the drugs, we need to make sure that they do not get HIV and hepatitis for as long as possible. But there is no good collaboration. Like, what are the criteria? We have 2 drop-in centers for people who inject drugs. One in Tajikistan, Spin Plus, and other one is Kyrgyzstan, and there is a women center in Tajikistan, and that is all. So where can we work? So what do we have now? What questions we need to address? Colleagues and the doctors from Kazakhstan and other countries, they say that people now use new psychoactive substances. They are not new for us, they are new for the specialists. And unfortunately, the system is not ready to help. For the last 6 months, we have been looking for doctors who will help us to provide online consultations on like pharmacy-based drugs and other new psychoactive substances, but we cannot do it because first, doctors do not have information, do not know how to respond to the substances that they have not worked with before. Our practices are not taken into account, and also there are safety considerations, because any contact with the doctor without decriminalization of people who use drugs can lead to additional problems, such as registration in authorities and information be given to the state-run drug control services. So all those things bring us further and further from prevention services. If you come to any site and syringe exchange program, the focus is on HIV. But if we talk about the HIV, people can be adherent to ART when they are stable, they do not have mental health problems, when they can come to a doctor and can access all the necessary services in one place. And speaking about the research studies, for us, it is important to make sure that study results have an impact on the practices. The question is not about like, do people use drugs? Yes, they do, like new, old psychoactive substances, etc. And we do not respond properly. We are delayed like about 5 years to the current drug scene, but we need to implement evidence-based international practices in our countries. So one thing is that we need to be mobile. That is what Nurali said. That first thing is delivery, and to save people, save their lives, save their health, we need to protect human rights, we need to consider safety and mental health. So those things are now not priorities for HIV prevention programs. Our group, our community, as people who use drugs, see it as a priority. So we would ask you, please show in practice that we are a priority, that you understand and accept our lifestyle, and you have professional skills to help us, not adding additional problems for us. Thank you. Thank you for your comment, Olga. It was a very right comment that we need recommendations to be implemented in practice. And now I would like to give the floor to our next speaker, Vera Lenkova, advisor on communication of the WHO office in Eastern Europe and Central Asia. Vera Ilenkova, please. Thank you, colleagues. I will try to speak about some general things now, and in the second part to speak about some more detailed things. First of all, I would like to join the colleagues who thanked the study group for this report, for conclusions and recommendations. And actually, conclusions and recommendations, they comply greatly to the reports of the UN Secretary General on the implementation of HIV/AIDS declaration based on in preparation to the high-level meeting to be held in New York on HIV/AIDS. So the results received within the study, they greatly show the global picture that we see in the world in the period of COVID. Even the recommendations, they are often similar. So I would advice like how this report can be used. Nicole was really right when she enumerated and listed all the opportunities for advocacy, and one of the nearest opportunities is the high-level meeting in New York. Now the national delegations are being formed to include the civil society representatives and government representatives, and the countries which took part in the research study, they could use those conclusions and recommendations to state their position, to promote the recommendations, and as colleagues said, to make sure that those innovations and best practices are implemented and make sure that they are part of the new political declaration on HIV if possible. And it was rightly observed that COVID as shown by the research results, COVID crisis just emphasized the existing problems. So not always the issues were related just to the COVID pandemic. So where we had some weaknesses and gaps, like the pandemic just showed us those problematic aspects and inequalities. In particular, it became evident that the model of HIV services provision with the regular examinations and regular visit to doctors, it should be reconsidered. And we are talking about decentralization. Of course, we need to decentralize testing, and also we need to differentiate the models of care. We need different models, not just for testing, but for HIV care in general. These models should be more flexible because we saw that it was difficult to adapt in the conditions of lockdown and movement restrictions. And with HIV, the situation aggravates with the fact that infectious disease doctors who provided HIV services, they focused their attention on COVID patients, and it had a strong impact on the situation. So we need to think about what new models can be used for the provision of care. So not only for testing, for care as well. So the last thing I wanted to say in this part, all my other comments will be in the second part. So from what my colleagues said and the recommendations and conclusions presented, make it clear that HIV cascade is not the end point in the system of service provision. We need to have a broader thinking, but we need to really coordinate our efforts and think about the quality of life and about all people around the people who live with HIV. Of course, it is important to put people in treatment and reduce their a viral load, but it's not enough to improve the quality of life for people who have who live with HIV, who have other conditions, other illnesses, and it should be considered as well as the social problems they face, because they also affect coverage with testing and retention in care and the linkage to care. So recently we talk a lot about the force 90, if we remember about 90-90-90 models, and the force 90 is the quality of life of people living with HIV, which cannot be ignored. So when we think about the new care model, we need to take it into consideration. So I would like to stop here, and maybe I will share my other observation in the second part of discussion. Thanks a lot, Vera. And now we start the second section of our event presentations of the country analysis. And I would like to give the floor to Alexander Nedushka to share his screen, and I will introduce Alexander now. So the next Belarus will be for Belarus and Moldova by Alexander Nedushka. He is a senior research worker of the Ukrainian Institute of Public Health Policy. So Alexander deals with practical medicine and research in HIV, tuberculosis, drug dependence, and sexual transmitted infections. So now we have a 10 minutes delay, so I would ask our next speaker to comply with the time slots for your presentations so that we have more time for discussions. Alexander, microphone on, please. And now I would like to use this time to invite all the participants to use chat to ask your questions, because our regional project and Tatiana Vinchenko from the Global Fund and our colleagues from the WHO regional office, they read the chat, so you can ask your questions in a chat. So please ask your questions. And now I would like to give the floor to Alexander. Good afternoon, dear colleagues. So I would like to present the data for the Republic of Belarus. I would like to join the expression of gratitude to people who organized this research study and colleagues who communicated with us to clarify the data that we were collecting. So for the first slide, you can see it on the screen. So here you can see the average monthly number of NGO-based HIV tests. So we had the data for 2019, and we had data for the first 9 months of 2020. So as we saw on the graph, in most months we had increase in the number of tests. So the increase in the first 9 months was by 11%. And especially for such cities as Minsk, Svetogorsk, and Soligorsk. According to the respondents who participated in the interviews, such increase in the number of tests is related to the change in indicators, and also to the biobehavioral research study with engagement of clients who previously did not use the services provided by the NGO. Also in the cities of Soligorsk and Svetlogorsk, the increase in the number of tests was related to the fact that those cities joined the Fast Track Cities program, and in 2020 they implemented broadly NGO-based testing.
So when we talk about HIV testing in health facilities, on the slide you can see that in 2020 we had a reduction, and the monthly reduction was 13%. And well, when we looked into individual cities, we had similar results, and also in some raions like Soligorsk and Svetlogorsk. And according to the experts, the reduction in the number of PHF-based testing was caused mostly it was related to the anti-epidemic measures, even though there was no lockdown per se in the Republic of Belarus, but still we had lower attendance in healthcare facilities, and also less people were willing to go to healthcare facilities for HIV testing. So when we talk about the number of patients on ART, those who initiated ART, we see the reduction. According to the experts, also this is caused by, first of all, reduced detection. Also, there were difficulties in reaching the infectious disease specialists, those who are responsible for the registration. Also, there were limitations in lab diagnostics because the laboratories were reoriented on COVID testing. And there was another additional factor that from 2018, ART has been initiated regardless of the CD4 level. So in 2018 and 2019, there was a very active recruitment in ART patients. And in 2020, we had patients who were firstly detected only the end of 2019. So there were less of those. In terms of conclusions, I can say that NGO-based testing still maintained its effectiveness, even though the number of cases detected went down. And in terms of healthcare facilities, yeah, the detection decreased in Belarus because the patients had less demand and they didn't go for health services as frequently. Other factors which influenced was the extended procedure for registration, epidemiological investigation. It just postpones the ART initiation after the diagnostics. And as colleagues already have said, yeah, decentralization of lab diagnostics is very important because it affects the ART initiation. There were also regulatory changes in the ART initiation when, regardless of the CD4 level, ART was initiated. And in the last 2 years, we had some serious changes to the national system of HIV services in Belarus. We had reforms at the level of the state and NGOs. We had certain changes in ART initiation. We have introduced dolutegravir, which is definitely an advantage. In 2020, the NGOs have scaled up their operation in HIV testing, and the indicators reflected that. So, recommendations. It would be great if we could study the reasons and mechanisms for decreased PHF-based testing. And as Nicole mentioned already, we should especially look into key populations. Some data is provided in the report, you can find it the link, but still, yeah, we really need to look into the cascade in particular key populations. Also, we need to optimize treatment regimens. And as colleagues have said, the COVID pandemics goes on. So we need to identify the preparedness level for the system. After the pandemic is over, what should be the new status quo? This is a matter for discussion. Also, we need to develop flexible mechanisms which will be able to facilitate response to not only COVID pandemics, but other biological threats. And it is a matter of funding as well. We have to have proper public funding to make sure the programs are resilient. And also we need to look into alternative funding methods in the situation of COVID pandemics. Also, we need to expand access to DLT-based regimens because it's, of course, is more convenient to apply. There's less chance of drug resistance, less side effects. Also, we need to shorten the diagnostic procedures period and initiate ART faster. Local labs have to be optimized so that ART initiation should be done at the place of patient detection. And viral load also, it's very important. We need to conduct the tests in the area where the patient is detected. And we need to coordinate the efforts of NGOs and public health facilities in the framework of HIV service provision. So this is it about the Belarus programs. And if you don't have questions on that, I can now move to Moldova. We will answer the questions in the Q&A session. And now let's proceed to Moldova. So the statistics for Moldova, including NGO-based testing in Moldova, as opposed to Belarus, are collected quarterly. That's why on this slide you see the information for the 4 quarters of 2020 and the first quarter of 2021. And we see that in the NGOs, we see an increase in the number of tests. there was a trend. In 2019, the share of the three key populations were 94% of those tested, but in 2020, they made only 64%. I mean, PWADs, CSWs, and MSMs. So the experts have explained the increase in the testing rate by the changes in service provision. Now it's being funded. If a client if each client is tested for HIV once every 12 months, then a payment is provided. So this has influenced a lot. And that's why we have more positive results, and that's why testing yield increased. When we talk about the decrease in the percentage of the main key populations, we've already seen in the experience of other countries which was presented. The thing was that also sexual partners of the representatives of key populations were engaged to testing, and this affected the ratio. And in 2020, as compared to 2019, there was a decrease in the number of HIV tests in public health facilities by 33%. And according to the experts, this was related to the quarantine restrictions. So mostly the patients were contacting the doctors by phone, and they couldn't go to clinics. Another factor found was the introduction of HIV testing at primary healthcare level. And according to the expert, this intervention was not properly supported, was not properly piloted, and it was not effective enough in terms of the number of tests and case detection at primary level. When we talk about ART initiation, this graph, this diagram shows quite vividly that firstly, the number of patients who initiated ART did not change. But when we looked into the monthly and compared to the quarterly indication, in the first months, there was no COVID. So the system operated at the same level. But when in March, first cases of COVID started showing up and the number increased in the second and third quarter of 2020, we have noticed a reduction in the number of patients who initiated ART. And the experts say that COVID pandemics and the lockdown has led to less patients initiating ART and less patients detected with the positive stages. So the conclusions. We can say that the services which are being provided by the NGOs, they are still effective. However, COVID pandemics has influenced the scale of testing negatively. And unfortunately, the HIV detection rate in public facilities went down. And the innovations related to the scale up of HIV testing at primary level would have benefited from deeper piloting and more support, and then they would be more effective. COVID-19 pandemic has negatively impacted on the number of patients who initiated ART, firstly because less patients were detected. And overall, the HIV service delivery system has been under active development. The reforms in the areas of monitoring and evaluation and funding and treatment regimen optimization and decentralization of services, all that was taking place. But however, the lockdown impacted all the efforts, all the reforms a lot. The National HIV Prevention and Treatment Program has been able to compensate for the negative impact of the pandemic on the testing component through collaboration with NGOs. However, it has shown lack of flexibility and sustainability in recording and initiating ART. And with the colleagues, we have discounted the new 5-year program by 2025, and it provides for the full transition of HIV prevention services to public facilities. The consultants, the experts who work in the area, they say that the full transfer of funding to the state has certain inherent risks. In terms of further recommendations, well, to ensure proper, sustainable and results-oriented public funding, the low threshold HIV-related services have to be integrated, and sometimes it really is important if NGO testing services would be supplemented by referral and registration services. Proper referral is the key. The recommendations also are reflected in more details in the report. It's about the decentralization of services at sub-regional and local levels, and also the provision of services by infectious disease doctors at rayon and district level has to be done to ensure proper quality of service. Another recommendation is to expand geographical coverage and range of HIV services. And besides that, also we need to implement the interventions and practices for HIV positive people, I mean referrals from the NGOs. We have simplified registration and ART initiation procedures. And the last recommendation on making sure there's less ART interruption, we have to ensure proper drug supply, ARV supply, making sure that they can be sent via couriers or mails, and the drug can be dispensed to whoever is needed. This was it about Moldova, and I'm happy to answer to any questions. Thank you so much, Alexander. Now I invite Mr. Alexander Zezulin to take the floor. Alexander is our other research, and he already presented on Kazakhstan, and he will now present on the Russian Federation. Alexander, please unmute your microphone. Yeah, we can see the slides. Feel free to start. So, dear colleagues, let me present the results on Russian Federation. I will try to be brief because we don't have much time. So, what is the main finding on Russian Federation? Is that it was very difficult to get the data to assess the dynamics. And we've got limited data on NGO. You will see the figures a bit later. And in terms of figures for the public sector, the data also was missing. I mean, nobody provided that to our official request, so we had to use the data which could be found in public access. And I must note that after we have completed the study and we have written the report, we have received the data from the Russian side, but we had no technical possibility to include them in the report. So what happened to the NGO testing? There's information that there was a serious drop in HIV testing, influenced by, firstly, COVID, and secondly, factors related to NGO operation. During the lockdown in Russia, they had restricted movement. People had to receive permissions to go to service routes, and these permissions had to be approved by the mayor's offices. However, public transportation as such was working. Also, currently, Russian NGOs have the opportunity to procure saliva tests and address them mostly to key populations to detect HIV. However, there are significant barriers in terms of legislations and bureaucratic obstacles which make the procurement and the use of these tests very complicated. In terms of the innovations in this period, in the period of lockdown in Russia, NGOs have found a way to restore testing level. They have been mailing test kits to people, and they created some system of monitoring to assess the results of this testing. So it is quite an interesting case. It's reflected in our report, and it should be noted when we discuss strategic perspectives of HIV service development in different countries. Also, we should know that just like in Kazakhstan, Russian Federation has a significant problem with blood testing at NGO level. We recommend a revision of these practices for Russia and Kazakhstan.
What else is important to say is that not only COVID impacted the level of testing in NGOs, also it was affected by the situation of state funding of certain program components. So the government failed to support certain methods such as outreach work and some other things such as case management to confirm the diagnosis, which was pointed out as an important factor by our respondents. There is also a tendency of decrease in testing of KPs. For example, in Perm Krai, the number of positive results of HIV testing decreased by 90.7%. So we can assume that a sufficient number of tests was run, but not among the people who actually were supposed to be tested with lower rates of HIV. So I hope that we will be able to check this assumption in further research studies, like if KPs have access to testing. So what happened with the healthcare facilities-based testing? We didn't have this information, as I said, but from the open sources, we know that the reduction in the number of tests was about 16%. That's a classic situation for the COVID crisis when clinics were refocused to work with COVID, and all scheduled medical services were reduced, and that is one of the sources where we get new HIV cases. So that is one of the explanations of why the testing level went down. So about the number of patients on ART, we cannot show the dynamic due to the lack of data. We can only say that in 2019, 85,000 less people received ART than in 2020. And we can also say that there was good collaboration of NGOs and public health care facilities to deliver ARVs to the places of residence of people. And also at the legislative level, there was a certain change in the paradigm because the views of the Russian Federation in terms of harm reduction was changed, and it the changes now were also reflected in the legislation, so we should continue work in this area. So NGOs together with the health facilities provided ART to patients in wide scope. Telemedicine was also developing widely and actively in this period of time, because there are not many infectious disease doctors in the country, and they provided consultations in online mode, which is a good practice. However, there are significant problems when patients need to go from HIV diagnosis to initiation of ART. Here we have a lot of barriers, such as epidemiological investigations for each patient, additional tests and examinations, and those are set practices. So we are asking to simplify them. It would be very helpful. So about conclusions, we can say that COVID definitely affected service provisions throughout the HIV cascade. There are big financial and administrative barriers for NGOs to continue their work in HIV response. However, there are some good models of collaboration between NGOs and state-run health institutions. As I said, NGOs had this innovation of testing and monitoring of results through dissemination of saliva tests by postal services. Another important conclusion is that there is a state program to fund NGOs to work with people living with HIV and to prevent HIV in certain regions. This mechanism is rather challenging and difficult, and our respondents said that often there is a situation when tenders winners are inexperienced organizations who do not have experience in service provision, so they offer low cost, but they cannot provide effective services. So the efficiency of such model can actually be questioned. Another conclusion is that we see an overall slowdown in NGOs' activities aimed at key populations, and an important finding in this report was that in December 2024, non-governmental organizations were included in the register of non-profit making organizations performing the functions of foreign agents. And it significantly affects the work of those organizations. It makes the reporting more difficult and makes it more difficult for them to cooperate with the state agencies. And there is even a risk that such organizations can be liquidated or closed. So what are the recommendations for the Russian Federation? So the main recommendations are that there is a need to envisage budget for the procurement and use of the best practices which were developed during the lockdown in HIV testing. In every region, there is a need to have a system to register, process strategic information on implementation of certain HIV prevention and care components based on which the such strategic information could be used for planning the further efforts in the national HIV response. Also, there is a need to scale up the best practices and strengthen the cooperation between NGOs and the government sector. and make sure that state agencies see NGOs as their partners. Also, there is a need to reduce the number of diagnostic and administrative procedures before ART initiation so that people start the ART quickly. And there is a need to promote the sustainable governmental funding to support NGOs. Thank you. Thank you, Alexander. And our next presentation is for Ukraine. It will be presented by Konstantin Dumchev, Director of the Ukrainian Public Health Policy Institute. Can you see it now? Yes. Thank you. So we'll start talking about the data right away. So in Ukraine, there are certain peculiarities in organizing the program. In particular, we have three principal recipients of the Global Fund, Alliance for Public Health, the network of people living with the HIV or 100% network, and Public Health Center of the Ministry of Health of Ukraine. So those recipients are responsible for different components, but in the period covered, they all had certain plans on HIV testing. So we will show the testing results separately for each of the recipients. Also, it is important to say that historically, Alliance provided services of HIV testing in key populations, and now there is a process of transition of such services to government funding. So this process has been continuing for several years already, so the trends that we will see are also related to such transition. So on the first slide, we can see the tests conducted by Alliance through a network of local NGOs. And we see that the blue indicators in blue, they are much higher, and in red are much lower. So it is related to the process of transition. So the number of tests run by Alliance went down, but it is still Alliance runs HIV tests among key populations, as you can see. So this reduction cannot be told to be associated only to COVID-19 crisis. It is due to the transition to government funding. And we have the situation, we can see the situation here of the number of tests by Public Health Center. So also it is done through a network of local organizations, and we see that nothing happened in the first months on the graph, and then we see in the last 2 months a rather high number of tests. There were certain issues, of course, in the transition. So we can see that in the early 2020, the number of tests was close to zero. Like in January, some tests were run, but in February and March, there were almost zero tests. It was due to the process of signing agreements and administrative procedures. So the services were almost not delivered. But then the process started, and in 2020, we can see that rather high levels of tests, about 50,000 per month, was conducted. And we also looked at the detection of HIV. So the number of positive testing results decreased by almost 30% compared to November 2018. But it is difficult, of course, to interpret it because we could only look at 1 month. And the third service provider and key recipient, principal recipient of the Global Fund grant is 100% live for network of people living with HIV. So also they have their niche, and they did not change their program approach greatly. So here we see a small decrease, or only by 7% in the number of tests in the projects, but among MSM, the number of growing actually, and especially among sex workers, it was decreasing, and the number of positive tests almost didn't change. And to speak more objectively and to evaluate the picture of NGO-based testing, we prepared a graph for all three organizations. So here we can see that there was a decrease in February and March in the number of HIV tests, but then the number of tests was equal or even more than in the previous year. Like in summer, for example, we see a higher number of tests, and in November, December, it was about the same as in 2019. But in general, if we look at 11 months, we will see a 20% increase. As for public healthcare facilities based testing, here we see a different picture. So we will see a 20% decrease in the number of tests. So we are comparing here 3 quarters, as we do not have the data for the 4th quarter. So of course, in the 2nd quarter, there was the biggest decrease because there was a very strict lockdown, the first lockdown introduced in 2020. In the 3rd quarter, the number of tests grew again, but not. It was not as much as in 2019. The percentage of testing among key populations was less than 10%, but we need to understand that this data is not only always objective, because the coding system used in public health facilities does not actually assess the behaviors, only like the purpose of testing. So it does not always show that people belong to this or that key population, and the number of positive tests did not really change. As for enrollment in care, we also had the data for 11 months, and we can say that there was no big changes, and the amounts in 2019 and 2020 were all more or less the same. If we look at certain months, so we will see decreases in April and November. So in April, we had the first lockdown, and in November, you can see the gray line, the growth of new cases of COVID. So there was a bigger burden and workload in healthcare facilities. So it can be the explanation of the decrease in number of tests run in health institutions. As for ART, here we have a similar situation as with the enrollment in care. So the test and the start approach is implemented. So there is a small period of time between diagnosis and treatment initiation. So the graphs are similar, and we can see the same decreases in the numbers in April and May, and then at the end of the year. So the reasons, apart from the bigger workload, it was also lower number of patients seeking medical services because of the concerns due to the COVID pandemic, and sometimes patients do not want to face additional risks of exposure. So what are the conclusions for Ukraine? The dynamics of NGO-based testing. it can be explained not only with the COVID crisis, but also with the transition to government funding. So the approach is changing to testing and to incentives also. So that is because why we have those changes. Also, we have introduction of index testing when positive patients are motivated to bring their contacts to the facilities to increase the detection rates. And also we see a broad implementation of self-testing, especially during the period of COVID pandemic. We saw an increase by 20% of NGO-based testing, especially considering the COVID challenges. So the programs were able to adapt to the new circumstances quite well. And the number of health facility-based testing decreased. The experts said that some additional factors were not only increased the workload in healthcare facilities, but also the healthcare reform, which is ongoing in Ukraine, and funding mechanisms, especially for specialized care, are currently being built. So we have transitioned to government insurance and state-run service providers. They not all of them participate in this reformed process already. We saw the number of patients registered for care slightly decreased, and we also saw the same thing with ART initiation, like slight decrease, and it reflected the situation with COVID and the lockdown restrictions introduced in the country. So to maintain the continuity of services, resources were mobilized and new approaches were introduced, such as delivery of ARVs by postal services with collaboration among state and non-governmental sectors with support of international donors. And the recommendations. Optimize the procurement system for drugs and laboratory reagents, and provide for emergency mechanisms. So in Ukraine, historically, the procurement system is turbulent, and the Ministry of Health, its operation leads to certain, like sometimes risks of treatment interruption, but the system was able to avoid such treatment interruptions. So it is necessary to adjust the mechanism of government funding. So for testing, this situation is not bad. And also we need to do the same for other services.
So decentralization is going on, and we need to continue it. The experience of intersectoral cooperation. Now, historically, in Ukraine, there were many good practices of this cooperation, and it has to be strengthened and used further. The innovations which came up because of the COVID-related stress, so to say, such as mailing test kits, or finding new ways to engage the patients. Well, they have to be scaled up. Well, this is it on Ukraine. Thank you so much, Konstantin. And now we continue to the open discussion on EECA. We have the first speaker who will start the conversation. And if you want to join the discussion, please raise your hand or write a question in the chat box. If you have enough time left, we of course will give you the floor. Next, I would like to give the floor to Anton Basenko, the advisor on communities, rights and gender in the Alliance for Public Health in Ukraine. Anton, yes, hello. Please unmute yourself. Yes, I am unmuted. Can you hear me? Yes. Yes, we can hear you, Anton. Yeah, sure. Let me just a second. I think I have not selected the Russian channel. Yes.
Сейчас слышно нормально, да?
Here it is. Now you can hear me well, right?
Инна, слышно?
Can you hear me? Just select Russian channel, please. Anton, I can hear you well. Okay. So, yeah, apologies for this hiccup. So, as I am speaking closer to the final part, having heard the previous speakers, I want to pass, I want to reference what we've heard. And I would like to say kudos to the representative of UNAIDS about this very important moment regarding the declarations. In terms of the high-level meeting on HIV, AIDS, we understand that it's only a draft declaration. The second reading is now being prepared. And as a member of the task force preparing this high-level meeting, I can monitor what's going on. And yeah, the draft is fantastic. However, certain countries of our region have a difficult stance on these successful and progressive moments. And considering that, well, we don't know what would be the final version of it, but it depends on us. It depends on our stance, on our advocacy work, and the work of our missions in the UN, in other international organizations. So I just wanted to highlight that importance, because we should also keep up with our advocacy efforts, because it's an important moment and it's coming soon. Next, I would like to say that we have heard a set of both positive developments and negative developments, and my colleagues from the community of people who inject drugs, they have some concerns. And I would like to concur to the words of Tatiana Benichenko that this report is easy to read, and the team of researchers and the methodology they've selected and the informants they found, well, I think it's all quite comprehensive, regardless of the details. It was easy to read, and of course the gaps which have been detected and COVID realities, well, they are related to both objective and subjective factors. And when we try to evaluate HIV cascade, and it might look a bit narrow, there's always a risk that we can only see things from, so to say, from our narrow approach to services or to the infrastructure, and then we wouldn't be able to see things wider. But this report actually is quite a good exemption from the rules, because it really has opened the whole layer of major issues. And it says that not only COVID as such has been creating problems, it's just some countries are in the transitioning situation, and it also is affecting the situation. The countries, they have difficulties with ART procurement, and it really creates another barrier for people to get the service. But I agree with Olga Bilaeva. We have to delineate. On the one side, we have people who are already detected, who are on treatment. And there we need to have, of course, all these innovations of dispensation of drugs for longer period and adherence support and so on and so on. But we are talking about the whole cascade, right? So we have to look into the first step, people who engage the people into the cascade through prevention programs or through harm reduction programs when we talk about PWIDs. So here, what's going on here and whether the organizations can respond fast and can innovate in the prevention area. I think here we must state that, well, in Ukraine, there's no discontinuation here. And instead of just sitting and saying, oh my God, people saw this as the window of opportunity, especially the NGOs. When we talk about the motivation of NGO staff, and they have used this window of opportunities. Okay, let's change this and do that. And we already see how, for example, the dispensation of OST for longer period, or harm reduction 2.0, or mailing, or leaving the kids in this in some drops, or couriering the kids. It's, well, it has already been mentioned, but still, we should remember that community representatives, especially criminalized communities, people who inject drugs, or sex workers. Well, we've heard many messages that people are not attending health facilities as often. But we should remember that these people already had weaker access to health services, and in COVID situation, they might lose this access at all. So my message is that we have to remember these people, and we have to think through this lens as well. So besides COVID response, we also have to remember that basic needs should be covered. And huge thanks to UNODC. In Ukraine, they supported the transportation of people to the sites when public transport was shut off, or special permits were issued for these people when they had to go to another oblast, or food packs, or pharmacy stamps were distributed. That was very useful. And when the basic needs of people are covered, then they also can think about going to get tested and so on. Otherwise, it would be too abstract. But basic needs have to be remembered. And huge thanks to the Global Fund for the second call for application. And now the countries really can take action based on the experience from 2020, and also referencing Olga Bilayeva's message on harm reduction. It's great that we've heard. It's great that the researchers are stating the changes in the drug scene. There are new substances coming up, not only and that is not only caused by COVID, but of course it was a factor. And also we need to change our approach accordingly. So there are many issues and concerns, but I would not want to paint the gloomiest picture. We just have to stay alert. We have to know the changes and respond appropriately. The Alliance for Public Health would now start mobile OST sites. We've launched the project called Drugstore for recreational drug users. In nightclubs, we distribute the tubes and harm reduction kits for non-injection drug users. And that's why in the new application, the Alliance has introduced the pilot for substitution therapy for stimulant users. And of course, it has to slowly become part of the normal practice, not only funded by the Global Fund, but probably in the perspective, it should also be supported by governmental funding. But it's possible. We can do that. We are doing that. And I would like to say thanks to all the researchers for making these high-level efforts available for people in a very clear form. And thanks to everybody who helped saving lives by providing these services, by doing all that, by helping people to prevent HIV or to get appropriate treatment, improve their quality of life. Thank you so much. Thank you, Anton. I would like to note that indeed this online format gives us more opportunities, because we see that people can do several things at the same time. So say hi to your beautiful family. And I would like to give the floor to Ruslan Paverny, the director of the Positive Initiative. And we've talked about the situation in Moldova. Now, Ruslan, could you update us about the situation in Moldova in the 5 months of 2021? Has the country adapted its services in response to COVID? Okay. Thank you, dear colleagues. I will try to be very brief. So, apologies, Ruslan. Could you please select the channels and speak into the Russian channel? Then all the participants would be able to hear. Perfect. Yes, thank you. Thank you, dear colleagues. I will be brief. I will try to be covering only the most important things. Well, the COVID story has taught us a lot. It has really covered the most painstaking moments, but we have provided some very good response. We adapted to the situation, and we came out with some very good ideas which are worth investing into them, because they would ensure flexibility and client-oriented approach in our services. It would be more resilient regardless of the situation. So first of all, now in 2021, we understand that all the lockdown limitations and the hype caused by COVID is going down, but the services are now more flexible. They are more sensitive and more open to the implementation of innovative approaches and to being closer to clients. So the foundation of all planning aspects at the national level, when Moldovan representatives are taking part at regional level planning, we put the prior experience. So now we move towards provision of remote services in all our program activities. We introduce new patient apps, the vending machines, patient accounts, and promotion through Telegram channels, and it all becomes a natural part of service provision in Moldova. So we did not fold under the pressure of COVID. We managed to wake up, to shake up, to get rid of things which were ineffective, and we made a step towards the update of the services. This is it in brief. If there are some more specific questions, then please ask them. I'm happy that in Moldova, we've managed to avoid some interruptions in services. People managed to really come out of it at a very good level. Thank you, Ruslan. The questions people, if you have them, then please write in the chat box or raise your hand and switch on your mic and ask them in person. And next speaker would be Igor Tkavenko from manager project from the Republican Center of Scientific Technologies and the economy of healthcare in the Republic of Belarus. Igor, could you please share what is the situation in Belarus in 2021? What has changed? Thank you, dear colleagues. Igor, if you could please select the language channel, the Russian channel. Hello, dear colleagues. Hello, and thank you for the work you've been doing, the great work which has shown both the pluses and the minuses of our work in the COVID-19 pandemics. I would like to know that the ART indicators in 2020 were not as bad as they could have been through the consolidated efforts of NGOs and HCFs, and because we didn't have very strict lockdowns in our country. And now we are trying to activize the work of mobile stations as part of the Global Fund grant. This year we have procured 5 additional vehicles which deliver ART to patients, and they also take blood samples for CD4 and viral load. These 5 vehicles will work in 5 most significant regions starting from the beginning of this year. Also, we have activized work on attracting new patients to treatment and on finding the patients who dropped out of ART as part of the social contract for 2021. And we can already see in the first quarter the increase in the number of tests for all key populations, and also in healthcare facilities. We can also see the increase among people who inject drugs. And as part of the current regional grant, we have launched the self-testing among MSM representatives. The representatives of this group can order the kit by courier or national post. They can order the express, the rapid HIV test, and after the test, they will be contacted by a social worker who is responsible for this remote testing, or they will fill in the feedback form on the site.
And also work is done with the MSM on adherence and delivery of ARVs at home to the patients. So consent is received for the ARVs to be delivered from the aid center to patients at home. So people who are self-isolated to prevent them from interrupting treatment and dropping out of the cascade. So that's a short update of the current situation. Thanks a lot. So I would like to give the floor to Vera Lenkova from the regional UNAIDS office to comment on this block of Eastern Europe and Central Asia. Thank you, Inna. I would probably like to focus on one aspect in more detail. So in general, we give a lot of recommendations, good and correct recommendations at the international level. When I say we, I mean all our partners like co-sponsor of UNAIDS and organizations working at the global and regional level. So these are evident things that we know what to do, but often the question how to do it in every particular country, the response will be different and will not be as simple as it seems. So when we mentioned the recommendation to hand out ARVs for a longer period, I think that almost all countries of the region implemented this recommendation. In terms of legislation framework, it was prepared like to hand out ARVs for 6 months or more, but at the same time, if in the country there is no stock of drugs, then in practice, this recommendation cannot be implemented. So in this regard, we need to work on it. And we mentioned this gap, like with the procurement system for ARVs, the tender system, like where can the country procure drugs through international partners or the global platforms, etc. So if we take Belarus, there was a rapid assessment of the needs of people living with HIV. It was done in April, and then in November, it was done together with People Plus organization. And according to this rapid assessment, only 2.5% of people in April, they said that they have the stock of ARVs for 6 months. So there are some major issues which need to be settled when we implement the recommendations, or recommendations to provide not offline but online consultations. Again, if we take Belarus, well, we can see that not all people living with HIV have an opportunity to actually use online consultations. They sometimes cannot use messengers, do not have the devices, and the consultants, they could see the difference, like of face-to-face consultations and online consultations, like how to keep patients' attention, etc. So there should be more focus on need, and more efforts should be taken, and that there is a critical role of communities here. In general, in HIV response, and especially when there is some health emergency. And the COVID situation, it clearly demonstrated in the region for people who maybe were not convinced about it, how important the role of communities is. So we talked a lot about state funding of NGOs and social contracting. And again, in many countries there is legal framework required, but there are some smaller regulations which need to be adopted at the local level. And without those regulations, the mechanism will not work properly. So why I'm saying all those things, I mean that we understand what to do, but we need to coordinate our efforts and include also the global fund to help the countries to settle those smaller practical issues, to make sure that the steps that were already taken, not to lose them, and to follow up on them and to implement recommendations fully so that things work in practice. Thank you. Thank you, Vera, for your comment and for your participation. And now I would like to give the floor to Elena Romanyak, expert of public health from the Russian Federation, so that Elena can comment on the situation in her country. Elena, please. Good afternoon. I would like to say that in the recent 5 months in Russia, there were certain changes, and those changes were about stabilization of the situation. And the main thing here is that we see more cases, and the number of beds in hospitals are occupied by COVID patients, and some hospitals are overloaded. However, the population is kind of tired of COVID, so probably we will not have new like strict lockdowns, but we need to be mobilized. And as civil society organizations, probably we need to understand that we need to act in a way like we are in a lockdown. Again, we need to deliver ARVs, we need to deliver tests, we need to implement online technology so to work as in the quarantine circumstances, and donors usually support it, and the Global Fund changed actually their concept to become more flexible considering the situation. And I would like, of course, to thank all the colleagues for that. And I would like to also say that considering the deficit of information, also the access to information is blocked. So fake information is disseminated, but we have a responsibility for such things, and the authorities say that there should be no criticism about the actions to fight COVID, and the colleagues actually described the situation of NGOs quite well. Like we need to work effectively and continue delivering services in those circumstances. And when the study was conducted, we did not have widespread vaccination. Currently, a vaccination is available. Having a passport, people can have free vaccines. And the recommendation of experts is that 60% of people who are vaccinated will allow us to curb the COVID pandemic. But with the current rates of vaccination, this goal of 60% can be achieved only in several years. The number of people vaccinated is going down, and there are no prerequisites telling us that the dynamic will improve. The process is quite well organized, but since April 21st, new barriers were created for foreign citizens. In Moscow, the private clinics received an order prohibiting vaccination of foreign citizens. There can be also different reasons for people not getting vaccinated, and Moscow is made vaccination readily available in like the trade malls and mobile sites, but only 10% of people are vaccinated. And we remember that in 2018, before COVID, there were studies when 24% of respondents, like among the Russian citizens, said that they thought vaccines were not safe. And now this number is about 50% of people who are afraid of vaccines. So considering the recommendations presented in the report, the priority for our country, of course, is enrollment in care and retention in care. And of course, NGOs in this respect have a big experience, and we hope that the call for proposals of the Ministry of Health will allow NGOs to access funding to be more confident in 2021. Yelena, thank you for your comment, which was very important. And now we will speak about the issues and problems faced by migrants. And we all know that the difficult situations and challenges migrants are facing due to the pandemic, and only with the help of NGOs and civil society, they were able not to interrupt treatment and still have access to services. So I would like to invite Daniel Kashnitsky, coordinator and co-founder of the regional group on migrant health from the Russian Federation. So Daniel, please share your comments with us. Good afternoon, colleagues. Can you hear me? Yes, we can hear you well. First, I would like to say thank you that migrants were mentioned in this report, and a good part of the report is actually dedicated to the migrants and how civil society responds to the challenges faced by migrants, especially in Kyrgyzstan. In the section on Kyrgyzstan, there is a big section on migrants. And just a short comment. Really, mobilization of civil society strengthened international like collaboration between recipient countries and sending countries and during the lockdown, and those efforts to transport ARVs and send ARVs to the receiving countries, they are now well developed. And also there are online consultations through Zoom, where migrants can receive a consultation of infectious disease, a doctor or another doctor. But in general, the COVID-19 scaled up the barriers which migrants were facing in the recent years to other populations as well. Like when the migrants went to a clinic in the receiving country to receive employment permit, if they were diagnosed with HIV, they were included into the list of the Ministry of Interior, and deportation is not often done because it is difficult to find a person. But if such migrant leaves the country, he or she is not able to come back. So it actually looks like a lockdown for people, which delayed treatment initiation, because of course, it is kind of possible to receive treatment in Russian, but it is very difficult. And to initiate treatment in their mother countries, they need to be physically there. And Russia is one of the 19 countries of the world which have criminalization of HIV positive foreigners. And foreigners, citizens who come to Russia, they come from countries which have lower HIV rates. So you can see on this slide that Russia is the leader in terms of prevalence in our region, even if in Ukraine and in other countries it is lower. So in Uzbekistan, Tajikistan, the HIV rates there is 4 to 7 and even more times lower than in Russia. So here we have HIV data among foreign citizens in the Russian Federation in 2019. So we can see that the prevalence among migrants is actually 3 times lower than among the Russian citizens. But of course, people who know that they have HIV, they will not come to the migration center to get tested. And also we can see that labor migration has a strong impact so on the prevalence of HIV. Like in Uzbekistan, for example, HIV prevalence among labor migrants is 4 times higher than among other adults, and so also it is twice as high as in the general population in Tajikistan, and so it makes an impact on the situation in the countries of origin when those migrants come back. And we made an analysis which shows that for Russia carries out big costs because migrants who are admitted to infectious disease hospitals with HIV-associated diseases. So the government has to spend about $3,000 per course of treatment, while HIV treatment per year is about $1,000. So the difference is like in the first cases, the costs are 3 times higher. So recommendations for civil society in Russia to ensure legalization of migrants living with HIV at the legislative level, also simplify the procedure of rejecting the deportation rulings for migrants who receive treatment, also cooperation with migrant NGOs, and in the countries of origin, it is important to recognize tests from private clinics, and it is important to give an opportunity to register people with HIV in the remote mode, so online without physically being in the country of origin, because it would allow to save lives of many people. Thank you. Thank you, Daniel. Very interesting and very important data. So in our program, we have also a comment of Nicole. And I also see that Olga Belaeva wants to comment. So colleagues, if you have some short comments, also please raise a hand. So we still have some time. So Nicole, do you have something to add about the situation in Eastern Europe and Central Asia? Please, the floor is yours.
Yeah, just a few points, technical points, and then more strategic. So technically, I've heard in several of the presentations that the detection rate has decreased. So, but we don't understand exactly why. So the changes in the way we have been testing because of the COVID pandemic has sometimes decreased the testing yield. And it would be good to monitor that and understand the reason. It may be different in different places because the ultimate goal is to have a higher yield and test the right people. Second technical point is the discussion on the decentralization, very important. So decentralization of testing and simplification, we need to really work on that. And we are looking for countries in Eastern Europe and Central Asia to start working with WHO on trying to look at the testing algorithm and test new approaches using rapid test. We have the tools to do that and support the country. So if Kazakhstan is interested, Moldova, any other country would be interested, we're ready to start right now. Third point is the differentiated service delivery model for people living with HIV. It's also important to assess what is a package of services that could be available at the different level of care and what would be the acceptability by the people living with HIV and the key population. So decentralization, of course, multi-month dispensation and further decentralization need to be assessed to be acceptable and of good quality. And it links me to the regional grant that we've been preparing. And that addresses these innovations that we learned from COVID and also the differentiated service delivery models and the decentralization of testing. So hopefully we'll be able to put that in place in the next 3 years together with the governments. Final point from my side is many of you are already aware the global strategies for HIV, STI and viral hepatitis from WHO are going to be updated. So for the period 2022 to 2030, so up to the elimination goal. And the year 2021 and 2022 up to May 2022 will be dedicated to these new strategies. And at the same time, we will also update the regional action plans for HIV, STI and viral hepatitis. So I make a call here for the civil society and all the actors and partners to contribute to the development of the global strategies and the regional plan, because this is your plan, this is the government plan, and the changes that we want to make is coming from us, from you. So there will be an online survey, first about the global strategy, what we think about the existing strategy and where we want the next strategy to go. So that's the opportunity for you to call for more focus on key population, more civil society engagement, decentralization of services, and all the specificities that are needed for our region should be reflected in the global strategy and even more in the regional plans. So looking forward to have a strong collaboration on the development of those strategies. Thank you very much.
Thank you so much, Nicole, for your comment. Indeed, it is very important to have close cooperation with the WHO, on the matters of treatment cascade and the activities in the region. And we also hope that we continue communication on the report and on further work in the nearest 3 years. And next, I would like to give the floor to Olga Bilaeva. Olga, the floor is yours. Thank you. I'll be very, very brief. Let me just clarify the message from our community. There was a meta study conducted a few years ago. The researchers took 120 something studies to measure the influence of HIV, the influence of repression on HIV rate. And if we follow the Pareto principle, and if we look into all the organizations which help people who use substances, then 20% of the time, if 20% of the time would be dedicated to changes in drug policies, then access to services would be ensured. Because you have to understand that for us, any medical service, any health services are considered through the following prism. Who gets this data? Who is going to see it? And it varies country by country. In Belarus, at the legislative level, it says that when the doctor takes a drug test, they have to inform a local police officer. And then, of course, there's a matter of criminal punishment, and it depends. And the threat of punishment is that it might be only a fine first or 10 years in prison. But nobody wants to be on the radar of law enforcement. And for us, we need the services, we want to get the services, but it's a great barrier that the services make us visible for the law enforcement, for people who are pro-repression. So the main task is to change the drug policy, because this is the cause of stigma and discrimination. And this is why the doctors don't understand why the police is standing next door to the OST room or syringe exchange room. We all have to look into it. We all have to be vocal. Soon we'll have June 26th, and we want to hear the doctors, experts from NGOs. We want to hear your voices in favor of humane drug policies. We had an appeal to the president of Kazakhstan for allowing to deliver methadone to inpatient facilities everywhere. Thank you so much. Thank you to all the researchers, to all the speakers who took part in this event. Thank you for the valuable input. And finally, I would like to note two things. All the registered participants who are waiting for the recording, they will receive all the materials from this event. They will receive the recording, the report, and the slides. And also, I would like to take the opportunity to invite you all to the regional dialogue, which will be dedicated to the new COVID application to the Global Fund. We started tomorrow at 11 o'clock Kiev time, and all the information is there available on the SOS project page. So please join the discussion. We will be happy. Thank you so much. And if anybody wants to add a few words, now it's the final opportunity, but I don't see any raised hands, so probably we will conclude. So thank you and see you soon. Thank you and good luck to all of us. Thank you. Bye-bye.